Okay, I just clicked on the record mode, so it's being recorded. So I'm going to repeat what I said. The gastrointestinal problems, acute problems respond very well to homeopathy, but you need to separate out the more constitutional problems, chronic problems that are more difficult to treat. So those of you that have your repertory book, look on page 609 in Kent's repertory. And you can see that the heading is rectum, the diarrhea. And this is a major cause of death in third world countries. And because of the lack of antibiotics, hydration, maintenance of electrolyte balance, there's a very, very high mortality. The general rule is to give the remedy after every diuretic stool. There was an article that was published in the Journal of Pediatrics, and this is a prestigious medical journal for pediatricians, and this was actually the lead article, and it was written by a colleague of mine, Jennifer Jacobs, and it was entitled Homeopathy in the Treatment of Childhood Diarrhea. And this article statistically showed that homeopathy is effective in the treatment of childhood diarrhea. If you're using the right remedy, you should see a response within 6 hours. So in other words, if you're using a homeopathic remedy and you do not get a response in 6 hours, then you have to change the remedy. So in other words, the general rule of thumb is to give the remedy after every diarrhea, every stool, and if it's the right remedy, you should see a response in 6 hours. If not, change the remedy. Okay, let's go into remedies for acute diarrhea. A really big one is Arsenicum album. This is the sudden onset of vomiting and diarrhea with a little cramping and burning in the abdomen, rectum, and anus. So characteristics are weakness, restlessness, and prostration. So one of the themes with Arsenicum album is the symptom of burning. So an Arsenicum album is a homeopathic remedy that is used in other conditions. Burning is the hallmark. Weakness and restlessness. It's also a very chilly remedy. This remedy characteristically has symptoms that are worse after midnight to 2 a.m. And they're very thirsty for small sips of fluid. They're anxious and they like people to be around them. They enjoy company. The smell of food makes it worse. So you can see that Arsenicum has a lot of strange, rare, and peculiar symptoms that you need to put in the back of your head. So when these symptoms surface, this will be a remedy to consider. Podophyllum also has some simultaneous vomiting and diarrhea, like Arsenicum album. And if you turn to page 532 in Kent's repertory, and I'm turning there, 532, and you'll see the rubric. Vomiting and diarrhea. And you can see vomiting, diarrhea before, diarrhea during. And that's on the second column. And you can see the remedies that are listed here. Arsenicum is listed in bold, and Podophyllum is also listed, and you see some other remedies there. There's much gas and weakness. worse at 5 a.m., and the stool can drive them out of bed in the morning. Explosive diarrhea, watery, profuse, and offensive. Empty, anxious, seeking feeling afterwards. Tends to be warm-blooded, and it's a common remedy for inflammatory bowel disease. And this is a remedy not to really cure inflammatory bowel disease, but is to palliate. So vomiting and diarrhea, if you look on page 532, you can see diarrhea before and diarrhea during the vomiting. Cholesynthesis. Okay, let me ask the group, is my voice still dragging, and is there still a problem with the audio, or has it seemed to be improving? Please let me know, because a couple of you are having difficulty. Because if we continue to have difficulty, I may disconnect and try to get another line. Let me just check here. Debbie,
it seems better at this moment.
Okay, it could be just was a fresh connection. So if it happens again, I do have a couple of high speed lines in my
Oh, it
room.
just did it.
Oh, you know what? It could be because
it just did it when you said it happens again.
Okay. All right. If it's a continued problem,
when you said happens again,
it could be because we're talking.
When you said happens again, it sounded like happens.
Okay, it could be that I'm talking to you and we're both using the bandwidth. So let me
okay.
Mute you. Okay. All right. Now, cholesynthesis is one of the unique homeopathic remedies that is associated with anger or humiliation. And these are gastrointestinal problems that come after a bout of anger or humiliation. It's usually a right-sided condition, and it's one of the main remedies for gallstone colic or kidney stone colic. And if you look in the Kent's repertory, and there's a section, mind, anger, ailments. So I'm looking on page 2. Mind, anger, ailments, and it's at the bottom. Ailments after anger or vexation. And you can see there's quite a few remedies listed there, but I'm mainly looking at the remedies that are in bold. And that's aconite, chamomile, cocculus, cholesynthesis. And that's what we're talking right about now, cholesynthesis. Also Ignatia, ipecac, nux vomica, opium, platina, Staphylos agria. So, and then there's another one, mind, ailments after anger with anxiety. And we can see arsenicum. So after anger with anxiety. So the cholesynthesis is definitely a remedy to think of when you have abdominal problems, diarrhea after anger. Belladonna, we've studied that just about every lesson so far. And we know that belladonna has a sudden onset with a lot of cramping and the other belladonna symptoms. And what are the other belladonna symptoms? Well, in addition to it coming on rapidly, there's usually a high fever, a thirst, quite a bit of thirst, especially for sour things like lemonade. And there's also a delirium with the high fever and temperature. Nux vomica also has cramping with the diarrhea, paralysis that works against itself. So it's not an effective cramping and paralysis. Constipation with ineffectual urging, alternating with severe diarrhea. So there is a rubric in your repertory, constipation alternating with diarrhea. And it has that strange, rare, and peculiar feeling like there's a stone in the stomach. Try to belch it, but it can't. Veratrum album, profuse perspiration, chilly, simultaneous vomiting, projectile vomiting. It comes on during the menstrual period, dysmenorrhea with much coldness, intensely thirsting, cramping pains in the abdomen. And veratrum is a very chilly remedy. So these people can be very sick. They have profuse perspiration, but the perspiration is very, very cold and chilly. And they have intense thirst, and they also have a peculiar feature. They like to suck or chew on ice cubes. Cuprum is similar to veratrum, and cuprum is a big homeopathic remedy for cramps. So they have a lot of cramping in the abdomen and the calves and other muscle parts. So when you have spasms in your finger, in your legs, night cramps, cuprum is a remedy to think of. And they have craving for cold drinks, which ameliorate or make better. Camphora is similar with tremendous chilliness and very little perspiration, tendency towards collapse. And camphora was one of the big homeopathic remedies that Hahnemann used during the cholera epidemic. And the cholera epidemic was successfully treated with homeopathy, and camphora was a big remedy for treating this very severe diarrhea. So, in addition to the remedies that I have listed for chronic diarrhea, you need to supplement with trace minerals, especially zinc and magnesium and potassium. Magnesium can be very, very helpful in reducing um, uh, the spasms and the cramping. Flaxseed oil, acidophilus, and kelp. Another homeopathic remedy is aloe, and this is violent tenesmus or spasm, profuse clammy sweats, rumbling, gurgling, and urging in the rectum, bloody mucus after much urging and straining. Urine passes with the stool, rectal incontinence, like currant jelly in consistency and color, aggravated at 5 a.m., warmth, ameliorated heat, and it can drive them out of bed. So there's a lot of really good remedies here for explosive diarrhea, driving the patient out of bed. And aloe is one of them, and podophyllum is another remedy that drives the patient out of bed. Ambrosia is a remedy for ulcerative colitis and Crohn's disease, simultaneous diarrhea and vomiting, sudden gushing of stool, more commonly in the elderly. Sometimes there's a depression associated. And a keynote is cold sensation in the teeth. Argentum nitricum, diarrhea from anticipation or anxiety. And Argentum nitricum is a big remedy in the rubric mind anticipating anxiety. So these are people that get nervous with an appointment or a scheduled event. They dwell on this, and it can be associated with diarrhea. They also tend to be extroverted, warm blooded. They crave sweets, and they also get diarrhea from sweets. So that's kind of unusual. Arsenicum. Remember, we talked about arsenicum. They have the burning and the restlessness, arsenicum for chronic diarrhea. Capsicum, small frequent stools with blood in the mucus, sudden craving for cold water after the stool, but the cold water causes chills. Much tenesmus after the stool, burning in the rectum and urethra. So the keynote with the capsicum is the burning in the rectum after the stool. And capsicum is, the pepper. And those of you that have overindulged with peppers, you know that you do have burning in the rectum during a bowel movement after eating a lot of peppers. So that's an easy way to remember that. China officinalis has many GI symptoms, tends to be bloating and distension, no relief from eructations or flatulence, gallbladder or kidney disease, worst fruits, milk, and fish, periodical dysentery, chronic cramping, abdominal pains, ameliorated bending or doubling, blood and stool and anemia, hepatitis, spleen problems, oftentimes a lot of fatigue. So the key with China officinalis is this idea of a lot of bloating and distension with no relief from belching or flatulence. Let's see, we got a. Okay. Mercurius, and we've covered the remedy mercurius before. Bloody stools and mucus. The tenesmus or spasms is not relieved by the stool, the cramping, never feeling a dun sensation in the rectum, aggravated heat and cold, chilly after a stool, bad taste in the mouth. Remember, we covered mercury, that they get a lot of perspiration, foul odor, salivation, and they're sensitive to temperatures. The heat bothers them and the cold bothers them, and they have this bad taste in the mouth. Nux vomica is a big homeopathic remedy for spasms, and they have tremendous spasms with the chronic diarrhea, cramping, and urging, and they feel much better passing the stool. Gastritis with nausea and vomiting, irritability, and chilly. Remember, Nux vomica is a homeopathic remedy that is often prescribed for overindulgence. So when people eat too much or drink too much, and then have symptoms of diarrhea, nausea, or vomiting, think of Nux vomica. So it's a remedy for overindulgence. Phosphorus is a remedy that's often confused with argentum nitricum. Both of these remedies are very extroverted and anxious, and they have a tendency from diarrhea from eating sweets. Phosphorus tends to be very thirsty for cold drinks, lots of nausea and vomiting, but they're ameliorated cold, but when the water warms in their stomach, they vomit again. So that's kind of a very interesting keynote. And remember that they want cold water. Warm water will aggravate them. But once they take the cold water, it goes into their stomach and it warms up to body temperature, they'll vomit. So a very, very peculiar symptom, which is a hallmark for phosphorus. Sulfur has the keynote that it dries them from bed in the morning. So as soon as the sulfur chronic diarrhea patient wakes up, he has that sudden urging with diarrhea, and it dries them from bed. They get a lot of excoriation and burning in the rectal area, much like capsicum. They're better at night. They also have rectal fissures and itching. Okay, now what I'd like to do is everyone, we're going to take an opportunity to work on a case. So what I'd like you to do is, here's the case, and I want you to outline the symptoms of the case and go into the repertory and try to find the rubrics that are appropriate. And let's come up with some ideas on a remedy. So you have all your notes in front of you. So everything that is listed here has come from the previous slide. So why don't we take about 5 or 10 minutes, and as soon as somebody has an idea about a remedy, if you want to raise your hand and give me your thoughts. Okay? So we have a case here. The diarrhea came on suddenly, and that's fairly typical with cases of acute diarrhea of an infection etiology. Watery, yellow stools, um, aggravated in the morning at 5 a.m. He's lost his stool several times with no warning. Stools are expelled with one big gush. The rectum and anus are very sore. There's a lot of growling in his stomach. Aggravated eating. And he has a loss of appetite. Nothing tastes good. Okay. Any thoughts? Okay, Debbie, do you have some thoughts?
Well, I'm apologize if I'm wrong, but the thing that came out to my mind was the watery stools and worse at 5 a.m. and explosive. So I'm coming up with the, and I can't pronounce it right, podolium. I don't know if that's correct or not.
Watery stools, explosive, and what was the other one?
Rush out of explosive to diarrhea out of the bed, urgency to, no, is that right or wrong?
Urgency.
Just a guess.
And you're looking at podophyllum?
Yes, thank you for pronouncing it correctly.
Okay. All right. Very good.
I don't know if that's right.
Okay, anybody else? Let's see, I'm not going to. Let's look here at the cases. Let me see. Case 75. See if I open new patient. Let me see. Oh, here we go. Here's 75. Okay, here's okay, I don't know if you can see this. These are the rubrics that I took. Stool watery. Okay, that's right in Kent. Stool watery, stool yellow, stool diarrhea, morning, driving him out of bed. Rectum diarrhea, stomach gurgling. Was there desires fruit? Or is this,
No,
let's see. Oh,
no.
forcible. Let's get rid of this desire fruit. Let's delete that. I don't know where that came from. Let's see. Morning rising after. Stomach gurgling, you'll agree. Let's get rid of this. There's really no mention of anxiety. Gurgling. Okay. Diarrhea in the morning. Okay. So we come up with a couple of remedies right here. And there isn't one remedy that covers everything, right? You see that? Natrium sulfuricum is here, phosphorus, which we talked about, sulfur, arsenicum, and podophyllum. So, according to the ranking, natrium sulfuricum is one of the highest. But then we'll also have phosphorus, sulfur. So, what you need to do then is we need to go into Boricky and read about each one of those. So I hope you have a copy of Boricky with you. And let's look at natrium sulfuricum. And we can look at the abdomen. So if you look at the diarrhea that describes loose morning stools, worse after spell of wet weather, stool involuntary when passing gas, great size of the fecal material. So, there really isn't anything that at least impresses me with natrium sulfuricum. Now, if we look at, now let's go and look at phosphorus, okay? So we'll turn to phosphorus for the abdomen. And then a very weak empty gone sensation, pancreatic, stool, difficult to expel, desire to stool, painless, coping, debilitating diarrhea, green mucus, involuntary. So once again, it doesn't seem like it's a fit. So then we go to sulfur. And I'm doing this because I want you to understand that, when you have a case like this, you find out, your top couple of remedies, and then you got to read about each one. And Boricky is the best place to read about it. And so I'm looking at sulfur right now. Rectum itching and burning, redness around the anus, morning diarrhea, painless, drives out of bed, hemorrhoids. So, sulfur looks like it might be a little bit closer than the other ones. And now let's go to arsenicum, okay? And see what arsenicum, and I hope you're following with me. Arsenicum album, let's look at rectum. Burning pain, tenesmus, small, offensive, dark, with much frustration, worse at night after eating, alcoholic abuse, cholera. So far, sulfur's up there. Now let's look at podophyllum. Okay, what do they have right here? Early in the morning, diarrhea, painless diarrhea, green, watery, profuse gushing, um, constipation, constipation alternating with sensation of weakness or sinking. So let's go back to our case. Watery yellow stools would thicken occasionally, then interspersed with much water. Uh, Aggravated in the morning, 5 a.m. Lost stool several times. Stool expelled in one big gush. Rectum and anus very sore. Much growling in the abdomen and stomach. Aggravated eating. Loss of appetite. So it's really between podophyllum and sulfur. And I think I agree with Debbie. I'd probably go with the podophyllum. Um, and then what you do. Okay, we're making aloe. Okay, 5 a.m. rumbling. Okay, we have another suggestion. And let me look here. Aloe comes up too. Watering, yellow, diarrhea. Okay, well, I'm glad some of you are thinking of aloe. So let's read about aloe. And then we can kind of vote on it. So go to your Materia Medica. Borges Materia Medica, and let's read about aloe. All right, where is it? All right, let's read this. Rectum, feeling of weakness, loss of power, the sphincter, sense of insecurity in the rectum, stool passes without effort, lots of mucus with pain, hemorrhoids, burning in the anus, constipation with heavy pressure. Um, okay, so I also like aloe. So aloe's up there too. So what do other people think here? Any other thoughts? So if we remove stomach gurgling, which may not be that important of a symptom, let's delete this. All right. We have aloe looks pretty good. So you can see this is some of the difficulty we have. Like, for example, arsenicum could be a possibility too if there was a lot of anxiety in the case. So this is where sometimes you have to go into, um, some more detail. But in terms of strength, natrum sulfuricum comes up uh, really high, and podophyllum comes up really high too. So any thoughts? Any other thoughts? We got a couple of votes for aloe. We have one for uh, podophyllum. So let's look at more at this and see if there's something that can help us. Um, aggravated in the morning at 5 a.m. Lost stool several times without warning. So being expelled with one big gush. Rectum and anus very so lost stool several times. So there's this incontinence without any control. Uh, so what remedy has that? Let's see. Let's go back up here. and look at some of these. So arsenicum album. So it looks to me like podophyllum has the best fit. We have the gas, worse at 5 a.m., still can drive them out of bed, explosive diarrhea, watery. Um, so my guess would be I would go with podophyllum. Podophyllum, that's what I would say. Um, let's see, does somebody else make a comment? The comment was one thing with podophyllum, it says diarrhea of long standing. So is this case, let's see. Let's see here. Now that's a good support for 5 weeks, had diarrhea for 5 weeks. So that also supports podophyllum, the 5-week duration. So I think that my vote is also for podophyllum. So how would you treat this? You would give a 30C after every bowel movement. And then you would, if he has another one, you give him another 30cc. And then if there was no change after a couple of hours, then I would consider changing remedies. So, any questions on this particular case? I think, Debbie, do you have a question? Do you have a question, Debbie?
I just wanted to ask when you're looking at that. Yes, can you hear me?
I hear
Can you
you
hear
fine.
me?
I hear you.
Can you hear me? Okay. When you look at that Rubik's Cube behind and you see all of the numbers, are you going by the second row of numbers or the third row of numbers? Because the top row of numbers is just going 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
What are you
The,
referring
the
to by
window
numbers?
behind that where it shows the
This
Rubik's
window?
Cube, the Rubik's.
This window here?
Yes. So see the three rows of numbers at the top
Yes.
there. So when you're saying that shows more, you looking at the 11 down at the bottom?
The 11 is the total value. You add up all these 3 and 5, 6. That's the total
Mm-hmm.
value. So all these have the same value. Because look, in watery stool, natrum sulfuricum has a 3 or a bold. They all have bold. All these remedies have watery stool. Yellow, podophyllum has a 3, but sulfur only has a 1. It's not as strong. These are values. So essentially, our top.
So when you're saying you're looking for the one that's.
Well, there's 2
I'm
ways
sorry.
of doing it. One way is looking for the one that has the best totality. And the best totality is natrum sulfuricum. But being a good homeopathic prescriber, you want to read about it. You want to read about it in the Materia Medica. So every time, if you have a choice between a couple different remedies, you want to read about the remedies in Boriki and read the description, and it'll give you some more insight. So, you could have gone with
Yeah, but
natrum sulfuricum.
The first four all have number 11s, which means, according to the computer, those 4 are equal until you break down the other symptoms.
No. The computer tells me
Correct?
that natrum sulfuricum is the highest because it has 2 3s here, 2 3s and 2 2s. That's why it's the highest.
Okay.
It just gives the highest. Also, it downgrades sulfur because sulfur is a polycrest. So I would not go by these numbers at all because you're over analyzing. This is just a guideline because when you're doing this on your own, I don't recommend you get a computer. The only reason why I'm doing this is just for illustration and to kind of save time. So you go through the repertory, you find out the remedies that are highly ranked, and you get a couple of remedies that seem to fit. But some people are picking up on one or two things, like the 5 a.m. Rumbling. Um, uh, Todd mentioned that the podophyllum has diarrhea with long-standing duration. Um, the gushing, things like that. So this is what we use to help us. Okay, so very good. Let's go back. Okay, acute nausea and vomiting in the repertory. You can find acute nausea and vomiting pages 504 to 511 and 531 to 540. And dose after each episode of vomiting or every 4 hours for nausea. And many remedies can treat this condition of nausea and vomiting. Arsenicum is for gastroenteritis or food poisoning, much fear when vomiting and struggling, burning pains, very acrid emesis, and you'll find that arsenicum is always worse after midnight, aggravated after midnight to 3 a.m. Cocculus is a big remedy for motion sickness, tremendous nausea and vomiting on slight motion, nausea and vomiting associated with vertigo. Mere thought or smell of food makes it worse. And this is a good remedy for car sickness. It's a remedy for jet lag. Cocculus is very effective for jet lag. Ipecac is severe nausea that's incapacitating, nausea unrelieved by vomiting, vomiting with another condition. It's interesting in the Materia Medica, in the repertory, anytime you have any condition with nausea and vomiting, Ipecac's considered. So if you have back pain and nausea and vomiting, Ipecac. Abdominal pain, headache, all these Ipecac covers. But that doesn't mean that every condition with nausea and vomiting is Ipecac. It's just something to consider. Nausea unrelieved by vomiting is kind of an interesting characteristic because typically the nausea is relieved by vomiting. Most of you that have had nausea and vomiting, usually you feel better after you throw up. Phosphorus, you have the burning in the stomach, craving cold drinks, which they vomit as soon as it becomes warm in the stomach. Remember, we talked about that. Phosphorus likes cold drinks, but they vomit as soon as the drinks becomes warmer in the stomach. Tobacco, motion sickness with nausea and vomit. This is the deathly kind of nausea with, so incapacitating you want to die. This is a good example of seasickness, when you really get violently sick. So if you're going on a cruise, make sure you take tobacco with you. It's a good homeopathic remedy after chemotherapy for the severe nausea and vomiting. Veratrum, violent or projectile vomiting, often with diarrhea. You get cold perspiration, chills leading to collapse. Remember, one thing characteristic about veratrum is this cold perspiration, and they can have violent projectile vomiting with the diarrhea. Hemorrhoids, typical treatment is high fiber diet, increased water intake, importance of daily bowel movement to avoid straining. In the repertory, you can find hemorrhoids on page 619, hemorrhoid pain on 623, doser once or twice a day. And these are the hemorrhoidal remedies: aloe, Aloe vera, congested hemorrhoids that protrude like a bunch of grapes, large and painful. Ameliorated cold compresses and cold bathing. Osculus hippo, pain in the rectum as if full of sticks, radiates to the small of the back and to the hips, combination of back pain and hemorrhoids. So the key thing with this remedy is the combination of back pain and hemorrhoids. Collinsonia, as obstinate constipation associated with or after pregnancy, itchy congestion of the pelvis, rectal fissures. So this is a remedy that is severe constipation, often associated with pregnancy. Hamamelis is one of our remedies for varicose veins. Is a big remedy for varicose veins and bleeding. So hemorrhoids are kind of like a varicose vein. So bleeding hemorrhoids is hamamelis. Paeonia officinalis, congested or thrombosed hemorrhoids, severe pain in the rectum, which lasts for hours after the stool. Touching is unbearable. So Paeonia officinalis, paeonia sounds like pain. I always think of that for severe pain in the rectum, which touching is unbearable. Raditania peruviana, rectal fissures, severe pain in after stool like paeonia. Hemorrhoids typically protrude with stool, excoriation and oozing, ameliorated warm bathing, or slow walking. But Raditania, I always think of this as a homeopathic remedy for rectal fissures and hemorrhoids, Raditania. Sulfur, rectal fissures, much itching around the rectum, oozing around the rectum, and highly offensive stool. So now I want to let's go to acute abdominal pain. The rubrics for this are on page 554 to 598. And if you could please open your repertory to 554. And it begins with the bottom right, abdominal pain. And you can see that it begins with the time modalities, morning, afternoon, evening, at night. It even gets specific times. And then it has to do with emotions after anger. It has to do with positions, bending double, bending backwards, in bed. It also has time associations with eating during breakfast, eating cherries, coffee after cold drinks. There's pain associated with the diarrhea. So you can just read through those to give you the connections between abdominal pain and different modalities. The pain is dependent on the etiology, numerous sources from colic to irritable bowel syndrome. Early cases of appendicitis can be aborted with homeopathy, which is truly amazing. There have been many case reports of homeopathy treating early appendicitis. Certainly, I wouldn't consider homeopathy treating a ruptured appendix, but the early signs of appendicitis. Also, gallstone colic can respond well to homeopathic treatment because remember, gallstone is an acute condition when you're passing a gallstone, and the homeopathic remedies can be remarkable to be reducing spasm and inflammation. Arsenicum, gastroenteritis, peritonitis, and the characteristic with arsenicum, if you ever just remember two things with arsenicum: burning pain, burning discomfort, and this restlessness. Belladonna, we've had this remedy before. It's the sudden onset, sudden congestion, inflammation, bursting and throbbing, extreme sensitivity to touch and to movement or jar, gallstone colic pain along the transverse colon. Baronia is the main remedy for acute appendicitis. It's also useful for perionitis and cholecystitis. And it's tenderness of the entire abdominal wall. And those of you that had appendicitis or know of someone that had it, you don't want to move at all. Even if someone bumps the bed, they have severe pain. They also want to lie on the side of the pain, and that's characteristic. Baronia has a lot of thirst for cold water, irritable, and wants to be left alone, ameliorated pressure, and aggravated coughing or breathing. Now, Baronia is not only a good remedy for appendicitis, but you might be thinking of a cracked rib. A cracked rib has a similar presentation where breathing is very, very painful. Any slight motion, you want to put pressure on the area to relieve the pain. So Baronia is excellent for cracked ribs, but it's the number one remedy to think of in acute appendicitis. Berberis, gallbladder colic, stitches, aggravated pressure. So this is different than Baronia. This is aggravated pressure. And chamomilla is a classic remedy for colic in infants. And the key with chamomilla is not only the restlessness, but angry, shrieking with pain, and they're unable to console them. There is a lot of irritability, screaming and whining, and this inconsolable nature. No matter what you do, you can't satisfy the pain, or you can't relieve their discomfort. Also, chamomilla is a good remedy for teething in infants. They have the same type of presentation when they're teething: the restlessness, anger, shrieking with pain, and nothing can help relieve their discomfort. Cholesynthesis is another remedy. Colicky pains in the gallbladder, ameliorated pressure, bending, doubling, coffee, and aggravated drinking and fruit juice. And remember, cholesynthesis is linked with anger, indignation, or anger. Dioscorea villosa, severe cramps, ameliorated bending backwards or sitting upright, aggravated bending forwards, ameliorated erectation, cutting, squeezing. They're very irritable and they want to be left alone, so it's similar to Baronia. Nausea at the thought of foods, and these are colicky infants who arch their back. So the peculiar feature with Dioscorea is bending backwards. Bending backwards makes them feel good. And bending forward aggravates. So this arching of the back for relief of abdominal pain is a keynote. Remember it, because if you see it, it's a clear-cut indication for this remedy. Lycopodium, right upper quadrant pain, irritable bowel syndrome, abdominal distension, ameliorated warm drinks, and aggravated 4 to 8 p.m. That is a keynote of lycopodium, typically at 4 p.m. These are remedies that no matter what the symptom is, their energy level, everything is worse around 4 p.m. Nux vomica, also a big remedy for abdominal pain, acute gastritis. Remember, we talked about nux vomica as a remedy for dietary indiscretions, overeating or over drinking. They're aggravated with anger, cold, and stimulants. So they crave stimulants, they crave coffee, they crave alcohol, but at the same time, all these things aggravate them. So Nux vomica is kind of like a highly wired individual. They are, the type A personalities, and they like stimulations, but stimulants make them worse. They're also can be angry individuals. Their anger is like a spasm too. You don't know when it's going to happen. It just spazzes out with anger. Dyspepsia, um, in the repertory on page 503, many remedies can treat this. Carbovegetabilis, we went through this already for other conditions, tremendous bloating with gas and indigestion. Burping ameliorates. Um, it is ameliorated with carbonated drinks, made worse lying down. They like to sit up. They have a cold, clammy sweat, aggravated rich and fatty foods. They're chilly and want fresh air. So these are people with air hunger. They need more air, they need ventilation, they need to be fanned, and a lot of bloating. So carbo veg, think of air expanding inside. They like the carbonated drinks. They want the air to be expanded inside, and they also want air outside. So the common description is air hunger. China, belching and flatulence with indigestion, aggravated eating fruit and beer, milk and fish, night sweats, um, strong craving for sweets. Lycopodium is a really big remedy for dyspepsia and gas and bloating. They have a lot of food reactions to foods, peculiar reactions. These are folks that don't like oysters and onions and cabbage, but they do have a lot of craving for sweets. Lycopodium is a really big remedy for liver disease. So hepatitis is associated with this type of dyspepsia. Nux vomica is another big liver remedy: nausea, vomiting, retching, dry heaves, belching, flatulence after eating. Remember the sensitivity to spicy foods, fats. They tend to have dietary indiscretions, type A personality, and often stomach problems, indigestion, and pepsia associated with anger. So in the rubric, mind, ailments from anger, you'll find Nux vomica. Pulsatilla, indigestion from fats or rich foods, ice cream or pork. And they also are aggravated in a warm, stuffy room. That's one of the characteristics of the pulsatilla remedy. They don't like fatty foods, pork, um, and all these foods aggravate them. Phosphorus, a burning pain, very thirsty. They like cold water. They avoid warm water. And if you think of phosphorus is an element that's combustionable and it burns very quickly. So these are hot, very active people. And that's why I think they like cold food and cold drinks, because it kind of cools their body. They like ice cream, cold drinks, they like carbonation, and they are susceptible to gastritis, peptic ulcer disease, and they have that burning pain. Constipation is often a constitutional problem, and usually we just don't see that many first aid cases of acute constipation. It's found in the rectum section of the repertory on page 606. So if you turn to page 606, you see rectum constipation, and it's a very, very big rubric with lots of remedies. And we talk about then the time duration. There's ineffectual urging and straining. Um, we have constipation in the morning, the afternoon, etc. And here's some of the few big constipation remedies. I think alumina is the number one remedy. This is a remedy associated with dryness of all the mucous membranes. It's a really big remedy for dry eyes, dry skin. So, and also remember, every homeopathic remedy has a mental and emotional component. So the alumina has a dryness of their mind too, dry wit, um, dry in their speech. So the constipation can be so severe they have to assist elimination with their fingers. Constipation in newborn. Interesting, strange, rare, and peculiar. They have an aversion or craving of potatoes. They also have a strange feeling of a cobweb feeling on their face. Calcarea carbonica, also a big remedy for constipation. Clay-like stool. Perspiration on the forehead, desire for eggs and sweet. They're chilly, aggravated, damp, and cold. Graphites has this peculiar symptom about a hard stool that stays in the rectum, a large hard stool. And we mentioned skin eruptions. Graphites is really big with skin eruptions. And the keynote with the skin is what? The honey-like discharge, the thick honey-like discharge from a lesion. Nux vomica, constipation with urge, but the urge is ineffectual. Small amounts are passed. And children may fear to go to the bathroom. That's one of the strange, rare, and peculiars about that. Opium is a narcotic, and opium does cause paralysis of the parasympathetic system, cause paralysis of the rectum. Obstinate constipation in infants, severe constipation in infants. Post-surgical problems with vomiting and constipation. Bowel obstruction. Silica, hard impacted stools, much straining, itching, lump sensation. And the silica personalities are very timid. These people are very timid, and they also have a low self-confidence. Let's look at heartburn. If you turn to page 499 in your repertory. Okay, 499. Here we are, heartburn. And I see heartburn in the daytime, heartburn in the morning, heartburn while smoking, afternoon, heartburn during pregnancy, heartburn after acids, after beer, after coffee, after eating, after drinking, in drunkards, after eating boiled eggs. So there's a lot of really interesting rubrics for heartburn, and they start on page 499. Nux vomica, acute and chronic gastritis, reflex esophagitis, contracting sensation of stomach, ameliorated warm drinks, and remember, remedy for overindulgence. Pulsatilla is the main remedy in pregnancy. Put a little star right there, especially when it's aggravated by fats. Robinia is the worst of all heartburns, like a battery acid. So put a little star by Robinia. Severe reflex esophagitis, hiatal hernia, sour and acrid irritation. And the severe intensity and burning is the keynote, one of the worst of all heartburns. All right, let's now review our homework assignment of the cases. So the first case was you're doing a home visit on a 67-year-old female with severe chronic shortness of breath who is housebound and on oxygen. She has chronic bronchitis that seems to come on every winter. She also has developed bronchitis again in the last 3 days. She is doing poorly and is quite blue. There's much rattling of mucus in her chest. 3, and she is having great difficulty getting up the mucus. She lacks the energy to rise and greet you. She is better sitting up. She is worse in a warm room and worse lying. There's a lot of swelling of her legs and drowsiness. So these are the rubrics: sleep, sleepiness; respiration difficult while lying; respiration rattling; generalities cyanosis; chest inflammation; bronchial tubes; generalities, winter aggravates. And this is where we find all of these symptoms. So this is a fairly deep kind of a case. This is a chronic state because this person is homebound. She's on oxygen, and this has been a reoccurring. So this is an acute condition, but it's an exacerbation of a more chronic constitutional. So certainly the best treatment for this individual would be constitutional remedy than acute. However, an acute remedy can help resolve the current acute exacerbation. And in some cases, if the acute remedy covers the constitutional, you'll have a profound effect on this individual. So what is it that stands out about this case? What is important? What is unique? What is different than the usual pathology that you might expect? And what are the symptoms that are clear and strong? And so the rubrics up above that are on your slide are some of the ones that I feel are important. So when you reproducize this case, you'll see the top list of the remedies, and carbovegetalis comes up number 1, camphora number 2, arsenicum album number 3, nux vomica number 4, antimonium tartaricum number 5. And when you do a computer analysis, one of the advantages of using a computer, it does it instantaneously, and it can save you a lot of time. So one thing is you can just say that the computer knows best and pick the remedy number 1. It comes up in your analysis, which would be carboveb. However, it's always much better, and I have to emphasize this, to take the top remedies in the analysis and go to the materia medica and study these remedies and see what fits the totality of the case. When you do look in Boricky and you do study the remedies, antimonium tartaricum comes up the most strongly. And she was given, this is an actual case, she was given antimonium tartaricum twice daily for 3 days. And within 3 days, all her symptoms had cleared, swelling was gone, energy was better, and the cyanosis have resolved. And she completely improved, and she was completely off oxygen. So the reason why I present this case is that don't fall into the trap. And this is one of the reasons why I strongly advise you not to get a computer program and plug in symptoms and just pick the number 1 remedy. You are not going to learn homeopathy. What you need to do is look at the symptoms, come up with a couple of remedies that you feel fit best, and then read about those remedies in the materia medica. The two books that you have, Kent's Repertory and the Materia Medica, are all you really need if you use them in the right way to become a darn good homeopath. So the old adage garbage in, garbage out. So a repertization analysis is no better than the quality of information you put in. So remember, the only purpose of the repertory is to get you into the right ballpark of remedies. The choice of the best remedy is generally made from a careful study of materia medica. Questions on this case? So antimonium tartaricum is the remedy of choice. Any questions? Okay, let's go to case number 4. This is a little more straightforward case. This is a case of croup. So one approach is to look up the most common croup remedies. And the most common croup remedies are spongia, aconite, and hepar. They're listed as the top 3 croup remedies. A better strategy is to look at the individuating, not common symptoms. So these are the symptoms that I looked up in the repertory. Cough croupy, cough dry, cough in the evening, cough warm drinks ameliorates, cough cold drinks aggravate, and hoarseness. I didn't use painful throat because that is fairly common. Could have used swollen and tender glands, which you'll find on page 474 and 472, but I believe this is also a common condition. You can see how these symptoms fit together in repertization. And the top 5 remedies come out are spongia tosta, Rumix crispus, Arsenicum album, Drosera, and Hepar sulf. Spongia tosta was given a single dose of 30 cc. Potency and all the symptoms resolved in 12 hours. Spongia is one of the main cough remedies. It comes from the freshwater sponge. It's one of the main remedies for croup, along with hepar and aconite. Typically, the cough in spongia is dry and is worse before midnight. It's said to have the quality of a saw going through wood or like seals barking. It is better from eating and drinking, especially warm drinks. Cough is worse from cold drinks and better from eating sweets. Often a large swollen glands, and they often have to clear their throat frequently, and there's throat pain worse from cough, talking, or swallowing. It's also a remedy for asthma when they have to lean forward, and better warm drinks and foods. The emotional state of spongia is generally one of great anxiety. The other 2 croup remedies are aconite, but aconite tends to be more in the first stages of croup, occurring earlier in the evening. Hepar is also a useful croup remedy, but is more useful for croup after midnight and later stages of the croup. So that's the results of your cases. So any questions? Any questions on your homework? I think I was very pleased. Most of you did extremely well. We have a question from Debbie. Miss Deborah.
Yes, and I'm. Can you hear me?
I hear you.
Can you hear me? Can you hear me?
Yes, I hear
Okay.
you.
Because you've done this so long, I'm sure it's easy for you when you say croup, and of course we've recently gone over this. You said, okay, the 3 things that first come to mind, and you listed those 3 remedies, and you're not encouraging us to do the computer because the computer makes those first 3 remedies come to mind quickly. But if you don't have that memorized, is there some sort of a quick list that we can get that if it isn't croup or it was something else, and that symptom comes up and the first 3 things to come to mind, it would be a list there for us, which at least helps us to get us started in the right
If you look
direction?
in your notes, the session 2 notes. It's in your notes. I talked about the 3
Yes.
croup remedies.
Yes, I'm
So
aware of that.
those notes are very valuable. That should be the backbone of your first aid course. Organize your notes so when you do have somebody with a cough or the flu, one of the first things you do is you can go to your notes. And then
Yes,
you
I'm
look
aware of that.
you look at each one of these symptoms. You know it's a cough dry. So you go into your repertory, Kent's repertory, and you look up cough dry. You jot down some remedies. You look up cough in the evening, cough warm drinks ameliorate. You may make a list of remedies. And what I would encourage you to do is make a list of the bold remedies. So if you have a rubric with 60 remedies, just make a list of the bold remedies because those are the ones that are strong remedies. Those are the ones you're going to probably have in your remedy kits, and those are the ones you're probably going to use. So there isn't like a
Yes, and
shortcut.
that's a good way to word it.
There isn't a shortcut that you can say, oh, there's a cough. What are the top 3 remedies? This is a case of croup, and the top 3 remedies of croup are aconite, spongia, and hepar. That doesn't mean that every case of croup will have these remedies. This is some place to start, but if there's something peculiar that supersedes some of these symptoms, you may want to go with a different remedy. Like, for
Yes,
example,
I understand that, but
if
at least it gets you in the right direction.
what is your question?
Yes, I understand that, but at least it starts you in the right direction so you can start willing off some of the ones that don't apply.
Well, the best way to start homeopathy is to have no direction. As soon as you have a direction, then you have a bias. You listen to the patient. What are their symptoms? I just said this because this is an analysis of the case. But obviously, when somebody comes in with a cough, you don't know it's a croup. You just take the case as it presents itself. So sometimes
But for I'm sorry, go ahead.
I didn't say anything.
You were beginning to say, but sometimes. But I was thinking, for an example, like urinary tract infection. A couple of things come up to the head right away, and you're not trying to be biased, but at least it starts you in the right direction.
Well, you have a list of common urinary tract remedies. If you look at the lecture, I gave you the top urinary tract remedies. You have that list.
Yes.
That's your list. Now, probably 80 to 90% of all urinary tract remedies will be covered with that list. This course is not meant for you to become a top notch professional homeopath. It takes years of training. This is a course to help you be in the ballpark for an acute remedy. So you know it's a urinary tract infection. You find out what are the main features, what are the main symptoms. The burning, is it burning before urination, after urination? Is there blood in the urine? What's the pain like? What's their mental and emotional state? How long has it been going on, etc. But you don't ask them questions. Just tell me about the urinary problem, and they'll tell you what the main features are. And then you make a list of those symptoms. You look in the repertory, and you may come up with 2 or 3 different remedies. Then you read about that in Boricchi's Materia Medica. You open up the chapter on sarsaparilla, and you read about it. You read about berberis. You read about Staphylos aureus, and you see if there's a remedy that fits the case. That's the way you need to approach the problem at this time. If you just use the repertory or you use a computer, chances are you're going to be consistently met with failure and you're not going to be happy. Remember, the repertory is just a guide to find out what remedies are in the ballpark. Then you got to pick up Boricchi and read. Boricchi is a nice thin book. There's not that much detail. He talks about the keynotes and the salient features of each remedy. And that should be a big help.
I just wish we could have a list of the keynotes to at least to start the process to eliminate the search down to maybe, the top few.
Well, you have the keynotes. That's what I'm lecturing on. I'm lecturing the keynotes. You have them right in front of you.
Yes, I
I'm giving
understand.
you the keynotes of each remedy. When I give my talk, I talk about arsenicum album. I tell you the keynotes. They're restless. There's a burning pain. They have anxiety. That's the keynotes. So if you have a urinary tract infection, there's a lot of burning, they're restless, and they have anxiety, you got 3 keynotes. It's not magic. You got to read the
I,
notes, every
I understand.
slide, and that's the keynotes. You're telling me you wish I would give you the keynotes. The last 3 sessions, I've been giving you keynotes. It's up to you.
No, I'm not talking about I'm not talking about the exact cases you're going over today. I just mean, was there a general list that had the keynotes that would help us on the cases that you have not taught us on?
Well, every case is a unique opportunity, and there aren't keynotes for each case. That would be like me giving you the answers. I'm reviewing the keynotes of each case. I'm giving you the actual summary of the case for your homework, and it's up to you to find out what are the keynotes of the case, and you match them with keynotes you already know. You have already been taught what remedies have cough in the evening. You've already been taught what remedies have a dry cough. You've already been taught which remedies cold drinks will aggravate. So you got to correlate the keynotes you already know with the particular case. But as you study homeopathy, it's going to get easier and easier because the keynotes are certain themes which go through every acute condition. Like a belladonna urinary tract infection has a lot of similarities to a belladonna flu, to belladonna diarrhea. There's certain keynote similarities, but you can't learn that in one lesson. This is something that you have to digest and absorb over time. And hopefully, as we go through different acute conditions, you will then begin to understand that. Because, like, for example, this is the 3rd time we've talked about arsenicum album. We've talked about belladonna every webinar. So you'll be learning the keynotes, and all of a sudden, the light bulb will go off in your head. Okay, thanks,
Okay,
Debbie.
thank you.
Okay, what I'd like to do now is go through some more cases. So let's look at this case. So diarrhea for wait, this is too. Let me just avoid this. Let's look at this case. Okay, let's go with this. No, yeah. Okay, a dark-haired. This is a case from the homeopathic textbooks from 1880. 64-year-old woman, desperately ill with erysipelas. Erysipelas is an infection of the skin. Bright red, smooth swelling covers the whole head. High fever with restlessness and delirium. Thirst satisfied by hot drinks. Bloody yellow nasal discharge. Pulse weak and thready. Tongue dry with brown crusts. Feel as if her limbs were scattered over the bed. So for fun, for the next 5-10 minutes or so, I want you to look in your repertory and look at some of the features. So erysipelas, you can find that. Let's see. So erysipelas can be in a couple different locations. Since it's on the face, you do face, and it's after eruptions. It's erysipelas. So face erysipelas, and you see the remedies that are listed under erysipelas. Also, high fever with restlessness and delirium. Thirst satisfied by hot drinks. So that's already, we can exclude some of the remedies that might come to mind. We've talked about phosphorus a couple times, and their thirst is satisfied but with cold drinks. We also have a bloody nasal discharge. So we can look nose, discharge, yellow, bloody. Pulse is weak. We can look up in the general section. Generals, pulse, weak. And this peculiar symptoms feels as if her limbs were scattered over the bed. Now, anytime you see something like that, that would be in the mind delusion section. So you look in mind delusions and read through some of those items, and there's pages and pages. And if you're not familiar with it, then you may have a difficult time finding something that's similar. But that's a very, very interesting symptom. So the way you would look something like this up, you would look delusion. You would look first maybe under scattered to see if it's there. And then maybe you'd look under delusion limbs to see if it might be there, or delusion bed. But the delusion section is one of my favorite. So what I'm going to do is I'm going to go to, I looked up Sue asked the question, the remedy that I chose for the child in case 4, that was spongia. Spongia. Okay, let's look. What was that? Let's see here. Mind delusion, body parts scattered about the bed. These are the rubrics we use. Fever intense, mind delirium, generalities pulse weak, nose discharge bloody, mouth discoloration, brown tongue. So these are the exact rubrics that were used. So mind delusion, body parts. Okay, so let's see. If I can find okay, let's see what we got here. Here was it. Okay, so these are the remedies that come up. Mind delusion, body parts scattered across the bed. And interesting, there's only one remedy there. Face erysipelas. That's the infection of the skin around the face. There's 62 remedies. Fever intense, 56. Mind delirium. General pulse weak. Nose discharge bloody. Mouth discoloration. And you can see that the phosphorus comes up pretty strong. But on the other hand, the thing that bothers me about the phosphorus is the symptom here. Thirst satisfied by hot drinks. That bothers me because phosphorus likes the cold drinks. It's aggravated. So everything seems to fit except for that. And let me get back to the chart here. Now, one thing that I really want to caution you is when you get a small rubric like mind, delusion, body parts, with only 3 remedies, you really have to be careful and put less emphasis. So if this wasn't part of the case, so let me delete this. Arsenicum would be number 1, and phosphorus would be all the way down here. So I tend to favor then arsenicum. So the important thing with this particular case is not to emphasize, one small rubric. So let's go back. Mind delusion, body parts scattered, face erysipelas, mind delirium, pulse weak. So we have it between arsenicum and pulsatilla. So which should be the first step that we look at? Why don't we look in Boricke's Materia Medica? All right. Because remember, the repertory is just a guideline to show us what remedies are in the ballpark. So let's look under arsenicum album. Restlessness, nightly aggravation, great exhaustion, weakness, burning pain, great anguish and restlessness, psoriasis. We look at some of the skin problems, fever, septic fevers, marked exhaustion, cold sweats, delirium, worse after midnight. And how about lachesis? What about lachesis? We haven't considered lachesis, so let's look up lachesis and read that under the fever section. And under the skin, face, purple mottled puff look, swollen, jaundice. So there seems to be a purple discoloration with lachesis. Septic states, trembling and confusion, a lot of loquacity, worse after sleep. How about belladonna? So you hope I hope you see kind of the method that you use here. You use the repertory to come up with what remedies are in the ballpark, and then you look through um, the Materia Medica Borici, and you read the different sections where your particular um, symptoms are found. So we're looking at fever, burning, pungent, steamy heat, feet icy cold, no thirst with the fever. So, okay, any thoughts, folks out there? I think one thing that we have to look at is the stomach. The thirst for warm drinks. So I'm looking for some feedback. What do you folks think? And I think the clincher is going to be as follows. If you turn to page 486, stomach desires, warm drinks. Arsenicum is a bold. So I think that is the clincher. Warm drinks. That gives us another 3, which clearly distinguishes. Lachesis is not there. Belladonna is there, but it's in a very small print. And Russ Talks is not there at all. So, assuming that this is an important syndrome here, thirst satisfied by hot drinks. And we know that arsenicum is very restless, right? So I think it's a perfect match for arsenicum. So you see what we did here. Okay, so we have an agreement. Veronica likes arsenicum. Sue likes arsenicum warm drinks and also restless. Very good. So we kind of came up with an answer already. So initially, we thought it was phosphorus, but something didn't fit. Phosphorus likes cold drinks and is aggravated by warm. And phosphorus can be restless too, but so everything fits. It turns out this is an arsenicum case. So that's, in a way, is how we kind of analyze this and come up. So I think that was a really good analysis. Green discharges. Sue asked the question, green discharges, does that count? Well, she has bloody yellow nasal discharges. The problem with these cases, we don't really know the degree of intensity. Is it a 3, is it a 2, or a 1? So anytime you're analyzing a case from the past or written material, it's always more difficult. I like to think if you have a person in front of you then you can kind of analyze, the nature of the person, ask some additional questions for for clarification. Okay, let's do another case. This is a 9-month-old child with colic that has persisted for 3 months. Worse, 9 a.m., very irritable and fussy, cries constantly. Nothing seems to help except Carium. Colic is worse when he is upset. So this is a nice case of abdominal um, pain and colic. So the first step I want you to do is to kind of look at this case and maybe come up with some rubrics. And then we can look at the remedies in the rubrics and see which one kind of fits. So irritable and fussy, crying constantly, nothing seems to help. But the top symptom is it's worse when he is upset. Um, so I can assume that maybe by upset, you could mean angry. So you might want to look at the rubric mind ailments from anger. That may be the big one. Then mind irritable. Um, this is also interesting that most of the information in this case is from the mind. There's very little to go on outside the colic is long-standing, 3 months, and it's a child, a baby, 9 months old. It's worse at 9 a.m., so it's worse in the morning. A lot of irritability and fussiness. So let's look. So here's nothing seems to help except the Carium. So these are what abdominal pain, cramping, generalities, forenoon, 9 a.m., mind irritability, children, mind desires to be carried, and ailments from anger. So anybody have any wild shots? Okay, Veronica has to go. So anyway, Veronica, I'll try to record everything. I broke it up this time, so it should work out well. And Debbie has a thought. She thinks it's chamomilla. Anybody have any? Let's see, Debbie, you have a Debbie, your
Yeah,
thoughts?
yes. Yeah, camellia, that one's easy because anger, great irritability, likes to be carried, worse after 9 a.m., worse at night, demands something and then throws it away. That one was easy for me. The last one was very tough.
Okay. Anybody else have any thoughts? You agree with Debbie, or so? Let's look at this. Let's see my symptoms. 112. Okay.
Oh, they're saying China. They're saying China is the
Oh no,
first choice.
this is something: complaining, disconnected, shrieking, aversion, touch. Oh, this is a different. I don't think this is a different. Something happened here. Let's go through these. I think I may have got some. Worse 9 a.m., irritable and fussy, cries constantly. Oh, 109? I think I got the wrong one. This is 112.
But you see how nice the computer program gives you like the top 5, and then you could start reading each one to see what the peculiars are. It's not so overwhelming then when you look at the book.
I don't have 109. Is it 110? I don't have 109 in here. 108. Let me just see here. I did all these cases. Oh, 110. It's 110. Here we are.
It's weird because the case said 109 on the other page when we read the case.
No, this is 110. Let me see. Yeah, here it is. Okay, so I'm looking at mind or abdominal pain cramping. Now, see, there's 203 remedies. So this really isn't that helpful. Remember, you want to try to get rubrics. Here's mind,
I think it's extremely
child.
helpful.
Well, it's not helpful because it has 230 remedies in it. So you need something more definitive.
Yeah, but see at the top, it gives you like the top 5 or so to look at, and then you can start looking for particulars.
It's not helpful. If you have a bunch of rubrics, which over 200 remedies, it's going to lead you towards polycrests, and polycrests are not going to get you the right remedy. All right. So like this one here, generals in the morning. That's a little bit better. Mind irritability, that's another large one. Mind desires to be carried is only 18. Mind anger. Oh, I have to change this. Mind anger. Let's see. Here, ailments. We got to put this in here. This has 0. Okay, so what we do is chamomile is still number 1. Lycopodium is up there. Aconite is up there. So, chamomilla looks like it's a good fit, but I would still go back to, Borky, and I would read about these. I would read about chamomile, Lycopodium, aconite, pulsatilla, staphylococcus, and arsenicum, and then kind of go back to the case here and look at it. But the point I'm making is these two here. Anytime you have a large rubric with more than 200 remedies, you're putting garbage into the computer, and you can be fooled with this. So, like abdominal pain cramping, if you look in your book, so everybody open up the repertory, and let's go to abdominal pain cramping. Okay, but there's nothing in this outside of abdominal pain cramping at 9 a.m. Now, maybe we missed something. Maybe there is a time modality, abdominal pain cramping at 9 a.m. Okay, so I'm looking here.
What page are you on?
Okay, I'm looking at abdominal pain burning, abdominal pain cramping or gripping, 573. Okay, turn to 573 at the bottom. Then we look at abdominal pain gripping in bed. There's 5 a.m., there's 6 a.m., there's forenoon, there's 9 a.m. There's only one remedy, magnesium carbonicum. You see that?
I'm on page 573, but I'm not seeing where it says magnesium.
Okay, turn to page 574. You see abdominal pain, cramping, gripping,
Okay.
and then you have morning.
Okay.
Abdominal pain, cramping in the morning. Okay? And then you have abdominal pain, cramping in the forenoon. Then you have abdominal pain, cramping at
Oh, I
9
see. Okay.
a.m., 10 a.m., and 11 a.m. Abdominal
Okay.
pain, cramping in the evening at night. So, okay, we have abdominal pain, cramping in the forenoon. Now, chamomile is not there, but magnesium carb is. Now, could it be magnesium here, cramping forenoon? Here's 9 a.m. right here. So I'm going to put this in here. And even though we put that in there, magnesium carb is still way down here. It doesn't have general mornings. I just did generals. We may want to take that out. Desires to be carried. Magnesium carbonicum doesn't have that, but it has the irritability. It has the cramping. But it has that peculiar thing at 9. So to me, the differential is between the chamomilla and magnesium carbonicum. So let's go to, and this is how you learn homeopathy. Things that don't fit, read it in your boric. So let's look at magnesium carbonicum. And we'll look at abdomen and see if anything kind of fits. It's frequently indicated in children. Whole body smells sour, disposed to boils, numbness and dissension, effects of shock blows, mental distress, sense of numbness, nerve, sensitive to least touch. Abdominum rumbling, gurgling, dragging, very heavy contraction, pinching pain. So nothing really resonates with magnesium carbonicum, right? So let's go back to chamomilla.
And sometimes they have the second word, which makes them different too. You've really got to watch that also.
You do. So let's look under chamomilla and read that. But I want you to get into the habit of really using boric. So chamomilla, German chamomile, mental and emotional group, disease of children, peevishness, restlessness, and colic give needed indication. Sensitive, irritability, thirsty, hot, and numb. So
Whining and restlessness, impatient.
yeah, so I definitely like chamomile much better than magnesium carb. But the only thing that bothers me is the 9 a.m. The chamomilla does not have. Well, let's look. Cramping and gripping in the forenoon. It has.
Can the time difference make you eliminate the remedy completely? Everything, even though everything else lines up.
That's a good question. In homeopathy, you always prescribe on what's there, not what isn't. So remember, these remedies in our case analysis is not an exact fit. The homeopathy is not perfect. Don't forget, we're dealing with many, many different time zones, and you have to ask yourself, what's the accuracy? Like, for example, if you're taking a patient's interview and they say, I wake up at 3 a.m., well, maybe it isn't 3 a.m., maybe it's 4. Or maybe they just flew cross country and they woke up at 3 a.m. in California and it was actually 6 on the East Coast. So that's the problem. Every symptom you have to take with a grain of salt. Now, if they would tell you every morning at 9 a.m. I get the severe cramps, and this has been going on for a week, that is really strong. And then you would have to say, if it isn't there, it's not the right remedy. Do you follow me? But we don't know the
Yes.
severity in this little history. We're reading, it's a paper case. If the individual, if that person was right in front of you, you would say, well, tell me about, are you sure it's at 9? How many times did it happen? And if they go, oh, Debbie, it's amazing. I could set my clock by it. I wake up, this pain is severe, it's agonizing, and it's been going on like this for 3 weeks. Then I'd say, oh my God, I'm going to be giving mag carb. Does that make sense?
Because then it's obvious. Yeah, it's obvious then.
So when you're taking the case, you have to find out what is significant, what is strange, rare, and peculiar, and you don't want to jump to conclusions just because it either fits the case or it doesn't. So that's part of the analysis. And what I'm trying to teach you is, you go through. Now, here's the thing. Abdominal pain, yeah. See, it's not there, but we have abdominal pain cramping, but the only remedy that is at 9 a.m. is the mad carb. But everything else fits.
And maybe sometimes they need both remedies, but spread apart and not done together. Is that possible?
Never say that. You're not a classical homeopath. If you're a sloppy homeopath, you'd say, well, let me give them both. In homeopathy, classical homeopathy, you give the best remedy. You wait. So if we give the chamomile and nothing happens, and then all of a sudden the next day they came back as the chamomile helped a little bit, but my God, I woke up at 9 a.m. and the pain was never so bad. I never had it so bad. Then you're going to give mad carb because the body will tell what it needs. You don't give both.
Gotcha.
Because then if the patient gets better and they got a relapse and there's another symptom, what are you going to do? Give 3 remedies and 4 remedies? Remember, the remedies remedies were
I know
not
you don't
proven.
give them together.
No, the remedies were not proven in groups. Chamomilla was proven by itself. Mad carb was proven by itself. The remedies were not proven in conjunction. Now, it'd be different if we did a whole series of provings with magnesium carbonicum and with chamomilla. Then would have a new remedy. Chamomilla slash
But like in
mad
that
carb.
case, but in that example you just gave, and they came back the next day, and the 9 o'clock, it's even stronger. So then you give them the magnesium. Would it have then told us that the chamomile was not the right one then?
It was not the right one. Right.
Okay. All right.
Okay, let's do. Let's see. Okay, let's do this one. 22-year-old female who got sunstroke while hiking in the mountains of Arizona. Temperature was 110 degrees in the shade, which is not unusual. That's a cool summer day. Upon reaching the trailhead and getting in the car, she collapsed. She is cold despite the heat. There is simultaneous vomiting and diarrhea and fainting on any motion. So this is a good case. Another acute case.
Okay, so where do you start? It shows number 3 collapsed. So how do you start that? Looking where?
Okay, well, that's where you have to learn. Open up and, maybe there's
But you go
Generalities
to number
collapse?
3 first. She collapsed.
Okay, well, you have to know the repertory. What do you mean collapse? Did her head collapse? Did her eye collapse? You look under generality. So open up your repertory. Open up your repertory, and you're going to go to the general section. And I'll be darned, generalities collapse. Remember, the repertory is scientifically arranged. If you're talking about a physical, okay, there's simultaneous vomiting and diarrhea. Where would you look?
Okay, so that's page 1350.
1350. So you look in there, and there's some remedies there. And these are the rubrics. Generalities collapse. Also look under head, sunstroke.
So then we would write down these bold words first under collapse.
Yep. So what you do is you write the remedies. They're the bold remedies. Now I had one.
AMC.
What we used to do. I'm going to put you on mute here. What we used to do on school is we would get a marker, okay, and we would put a marker like in each. So in 1350, I would put a little marker, a book marker, and then sunstroke, I would put a marker. We are going to talk about computerized programs, okay, coming up in one of the classes. So a lot of you are interested in the computer programs, but I'm telling you, if you jump right into a computer program, you're not going to learn homeopathy. You got to study with the book. You got to open a book. You got to learn the pages, because if you get a computer, you'll never open up Kent. You'll never look at Boriki. It'll all be in the computer, and that's going to prevent you from being a good homeopath. You got to learn. You got to know these pages, because, for example, when I'm looking on page 231, I'm seeing the word sunstroke. I see a bunch of remedies. Then I look above. Oh, there's a word stiffness. There's a splashing of the head, smaller, striking of the head. You're learning the language of the repertory. So, sunstroke, head sunstroke. So you put a marker there. You have a marker on collapse. Then you also look in generalities. Change aggravates. Temperature. Change temperature aggravate. That's on page 1347. And you see a bunch of remedies there. So you would write down those remedies. Okay. Arsenicum, ranunculus bulbo, verbosum, and then stomach, vomiting, diarrhea. So let's go to stomach, vomiting, where's stomach, vomiting, diarrhea? Can somebody give me the page number? Okay. Vomiting, headache, vomiting in the morning, at night, aggravation, coughing, diarrhea. Here we go. Stomach, vomiting, diarrhea. That's on page 532. We have a bunch of remedies there. Then we have generalities, fainting, motion. Generalities, fainting, faintness, moving, unmoving. It's 1360. So there we found everything in our repertory, and that's 129. Let me pull that up. I think I did it. 129. Okay, these are our remedies. Okay, and let's look at them. Generals collapse, change in temperature, vomiting and diarrhea, faintness on moving. But the head sunstroke, that's kind of like the one with, and let's look at some of these. So let's look at some of these remedies. Stramonium, white argentum nitricum, camphora, belladonna. Okay, so let's read about some of these. Arsenicum certainly comes up very high. There's all threes and all of them. But one thing you have to remember, arsenicum is a polycrest. By polycrest, it's a big remedy that's been involved in a lot of proving. It's in many rubrics. So you always want to explore some of these smaller ones before you jump to conclusions. So let's look at some of the peculiar things. The collapse, change in temperature aggravates, the vomiting and the diarrhea, and the fainting motion. Let's go back. So it's the collapse. So sunstroke may not be that important. You're assuming that it was sunstroke because she was hiking in the mountains and the temperature was high. It could be due to something else, but she did collapse. So we know that that's the three. Sunstroke is kind of a diagnosis. Quite cold despite the heat. Did we really cover that? So let's look here. So we really don't have a rubric here. We need something to find the rubric for the chilliness. So that would be under, let's look in the repertory and see if we can find it. So which section would you think that would be? Now, see, that would go with veratrum. So let's look in veratrum. I don't have that even though she had the sunstroke and she collapsed, her body is very cold. And that's a kind of a veratrum syndrome. Perfect picture of collapse with extreme coldness, blueness, and weakness. I'm reading this. Cold perspiration on the forehead with nearly all complaints. The profuse, violent retching and vomiting is characteristic. So this collapse with coldness. So let's look and see exactly quite cold despite the heat. So this has to be something very, very prominent in the case, and we don't have this in our rubric. So let's look respiratory, heart, extremities. So quite cold despite the heat. So let's look under arsenicum album. Great exhaustion. Let's look if there's any indication of extremities, cold fever. Fever, high temperature with cold sweats. So for me, let's see, Todd Wiley has a comment. Under collapse, arsenicum listed under diarrhea, sudden, and vomiting. So to me, both of these remedies, arsenicum and veratrum, are remedies for collapse. They both have change in temperature aggravates. But the thing is, the coldness. The coldness just isn't there for arsenicum. So I'm leaning more towards veratrum in this case. So one thing about this particular situation, if you give the right remedy, I would expect immediate response in this condition. So I would give a dose of veratrum and wait, and if there was no sign of a positive change, and then I would immediately give the arsenicum. But at this point, I think it's very close. Uh, I like both remedies, but I'm leaning more towards veratrum, mainly because she's quite cold despite the heat. Quite cold despite the heat. Now, what I need to know is this quite cold despite the heat. Is there any cold perspiration? If that would be a definite indication. Also, veratrum. There's a differential with veratrum. Arsenicum album likes warm drinks. Veratrum likes cold. Arsenicum has more restlessness. Of course, she's collapsed. You can't tell, but maybe prior to the collapse, was she restless, or was she craving cold drinks before she collapsed? So, if you were actively there, you could use these questions for differential. But anytime you have this is called a paper case, you don't really have a lot of detail in front of you. You're kind of hamstrung in terms of really defining it. So I would say yeah, Debbie makes a comment. There's 4 different arsenicums. Amen. So there's all kind of different arsenicum salts. Okay, I want to finish by talking about post-traumatic stress disorder. There are some other cases listed there that we didn't go through. You're welcome to go through the cases. and send me your remedy choice and what remedy you think is the best choice, and I'd be happy to tell you what the remedy was chosen in the actual class. Because remember, these are not my cases; these are cases that were presented at the American College of Homeopathy. These are from other practitioners, so I'm just reporting on their information. So we're going to be finished with post-traumatic stress disorder, and I want to spend some time on this because I think this is a really important condition. We're seeing more of this, not only with the soldiers that are coming back that have been in traumatic situations, but also all the traumas that are occurring according to most recent shooting and of all the kindergarten kids, which has just been so awful. It's kind of affecting me in a certain way, and I've been dwelling on it, and I can't get it out of my mind. It's like just an amazing nightmare, and so homeopathy can really help. I mean, it's not going to eliminate all the pain and problem, but it can be a wonderful way to kind of palliate the trauma. And I think all of you are going to be faced with situations in your life where you're going to see individuals that have this disorder. So it consists of recurring nightmares, flashbacks, numbing of emotions, depression, anger, irritability, feeling of intense guilt, lead to substance abuse and anxiety disorders. And that's where homeopathy can help. Okay, let me. So there's a lot of conventional treatment, cognitive behavioral therapy, group psychotherapy, eye movement desensitization, etc. And homeopathy can be very effective study. There's a study being done at the University of Arizona using this for homeopathy for this condition. The University of Arizona is doing a lot of work looking at the use of homeopathy with chronic problems. I was involved with a study looking at homeopathy in the treatment of fibromyalgia, and it was published in a major medical journal that homeopathy can be very helpful for fibromyalgia. Okay, so these are some of the rubrics that you can use for post-traumatic stress syndrome. Mind ailments from anticipation, mind anguish, mind anxiety with fear, driving from place to place, mind anxiety of consciousness, mind brooding, mind cares, worries, full of, mind delusion, everything is unreal, strange. So make a note of these. And what I would recommend if you're interested in this disorder, I would look at each one of these rubrics in Kent, make a list of the prominent homeopathic remedies, and then read about them in Boriki. And that will give you kind of a good understanding of each one of those remedies and how they're important. Mind dream as if in a mind dreams nightmare repeating. Mind fear people of accidents, death, something will happen. Mind frightened easily. Mind horrible things, sad stories affect profoundly, and mind hurry. Okay, and here's some more. Mind impatience about trifles, mind irresolution, irritability, lamenting, remorse about trifles, restlessness, mind sensitivity. So you can see that when you are uh, attempting to help an individual with post traumatic stress syndrome, you really have to find out where the mental problem is, the deficiency, where is the pain, how is the body reacting. Remember, in homeopathy, there just isn't one remedy for post traumatic stress syndrome. It's how that person is manifesting the post traumatic stress syndrome. Deborah, you have a question?
Just before you left the ARS remedy, there was four in there, and then sometimes it would just say ARS. How would you know which of those four, except that you have to go read and study each one? But one of them for the ARS said cold even sitting in front of a fire, and the other one said chilly and cannot endure any cold at all and is sensitive to the heat. So there was a number of those ARSs that did line up if you had looked under where the temperature was.
Uh-huh. You're
I'm
talking
sorry, I
about,
had raised my hand when we were on that last one, not on the new one here.
well, you're talking about different arsenicum salts.
Arsenium.
There's arsenicum album, which is the main one.
I'm just talking about reading.
There's arsenicum.
I'm talking about just looking at Borik's book and looking under.
Yeah, well, there's a bunch of arsenicum salts, and each one is a little bit different. But we're just mainly talking about arsenicum album. There's arsenicum iodatum. There's arsenicum sulfuratum. There's a bunch of them. So yeah, each one has a different characteristic.
But how would?
There's arsenicum sulfuratum.
But Borik has got them.
Yeah, boricum has them.
Borik has them all together.
Yeah, they're all together because they're in alphabetical order. But these remedies are here, but these are smaller remedies. They're not as common. And you're probably not going to use them for your stage.
So we don't look at the other ones.
You can read them, and if something really fits, you could probably order the remedy. But these are very tiny remedies, and the chances of you using a homeopathic doctor that's practicing for 30 years may only use them once in his lifetime. And
but if we don't know that, how do we know which one is the main one?
Arsenicum album is the main one. Arsenicum album is the main arsenicum salt. You can study all of them, but I think you're wasting your time. You're much better off, studying the major polycrests and major remedies. But we have a lot of material.
Yes, I understand
here.
That. But if we don't know which one is the major one,
well, you have to take more advanced studying. This course is not to tell you which is the major one. I'm telling you the major one is arsenicum album. That's the major one.
Yes, I understand that. But
okay. So anyway, I was mentioning that these are the mind rubrics, and when you're doing or analyzing somebody with post-traumatic stress syndrome, you have to determine how that individual is manifesting that post-traumatic stress. You have to find out which of these rubrics are more prominent. Mind sighing, startled easily, thoughts disagreeable, thoughts frightful, thoughts persistent, thoughts repetition. So you have to find out what are the main themes, what are the prominent themes that can guide you to the right remedy. So let's talk about some key remedies that are very, very characteristic of post-traumatic stress. Aconite strongly carries the fear of sudden death, sudden intense threat from the outside that comes suddenly and goes suddenly, fear of accidents, of suffocation, delusion he's about to die, racing pulse, palpitations, flushing of face alternating with paleness, shock, great nervous excitability. Aconite is often thought of as an acute remedy, and it is very commonly an acute remedy, but aconite can lead to a chronic state. I had a very, very profound case. This was an elderly man. He was a World War II veteran, and he came in to see me because he was going blind, and he had marked constriction of his visual field, marked constriction. And I couldn't figure out why he had a constricted field. I couldn't identify any particular disease, but he was very visually disabled. So I decided to do a homeopathic intake on him, and I was talking to him, and I found out that he served in World War II. And during one of the battles, his best friend, very, very close friend, was hit with a mortar shell. And he actually watched his friend vaporize in front of him. And he ended up with all of it, his friend all over him, his parts of his body all over him. And he told me ever since that day, he has not been able to sleep. He cannot sleep. And he's carrying this strong fear, and he fears that he is going to die. And, he has this racing pulse and palpitations, and this is every night. So I gave him a dose of aconite, and it greatly changed. And my goodness, this was like 50, 60 years ago that this happened. And I gave him a strong dose of aconite. I think I gave him 10 m, which is an extremely high dose, treating him constitutionally. And it really changed him as a person. His visual field began to expand, and he was finally able to sleep at night. It just helped him release this that was inside of him. So remember, aconite has that peculiar thing of fear of dying, and sometimes they can actually predict the time of their death. They get a sensation that they're going to die tomorrow or in 2 weeks, but an amazing fear of death. Arnica is another powerful remedy for the aftermath of trauma. We often think of arnica as just being a physical remedy for musculoskeletal damage or trauma, but it also can be a very, very powerful remedy for emotional trauma. These folks are startled easily from sleep after frightful dreams, especially frightful dreams after an accident or injury. These fears can persist both during the day and night. They're oversensitive. They want to be left alone, and the hallmark for an aconite is okay, I'm okay, and they refuse to want to see a doctor. Anytime you see somebody in an accident, they fall, they hurt themselves, and you ask them, you okay? And they go, I'm fine, I'm fine, I'm fine. That's like the arnica state. They deny that anything ever happened. And they can be dictatorial and very morbid in their thinking. Chocolate is a very big homeopathic remedy. So chocolate is more than something to eat. Chocolate has a remedy that has been proven extensively in homeopathy, and it's becoming a bigger and bigger remedy. The features of chocolate is the want of warmth and affection, need for contact. Chocolate is kind of a comfort food. You have a warm feeling. Some people have a love of chocolate. And it's the feeling of a child separated from the mother too early, when the need to suck at the mother's breast was still very strong and that was separated. So they have this forsaken, isolated, and estranged feeling from the family, anxious about the future, and craving love and contact. So this can be a manifestation of post-traumatic stress disease. Opium is particularly useful when the stress relates to the situation of war, state of suffering, a great threat, and fright, so much that the person becomes numb, insensitive, and indifferent in order to survive. Because the situation is just too much for that person to bear. So, lost in their own world, gentle and mild, no anxiety or fear, nothing affects them. So, this numbness, the threat is just so overwhelming. This person becomes numb or different. And in a way, it's kind of like a deep, deep drug state. The opium state overcomes them with this numbness, so they really can't feel the pain. So opium is a really valuable remedy when they're just not able to get in touch, with their feelings. Um, so I would think that probably what has happened, the incident that occurred in Connecticut, is an opium state. Uh, People are just walking around; they're numb. Um, it's just they've become indifferent to the suffering and pain, and you have to, because if you really would absorb all the pain and grief that's going on, it would be overwhelming to the average person. And I think another opium state that occurred in our country was 9/11. With the loss of the World Trade Centers, that was an opium state. We were just walking around in a numb state. So even at this time, if you do meet individuals who are just out of touch and insensitive and numb, and this is definitely an opium state. Stramonium is powerful fears and violence, feeling of being left alone in the wilderness, abandoned, forsaken. Stramonium, they have very, very violent nightmares, a really, really deep sensation of being forsaken or abandoned. And the brain just refuses to work properly. They can't recognize who's around them, and they cling to whatever is there. Crying for help, begging, praying in a panic state, wants to be in a safe and secure place, reacts wildly and violently to his terror and fright. So these are people that can really act out and become violent because they want to get to a safe place. So this can be a, a very dangerous state uh, with a display of violence. Many other remedies can help: ammonium carbonicum, ammonium muriaticum, ambergresia. This is a whole list here. And many of these remedies are made from drugs. You see lithium and cannabis indicus, marijuana. Um, so a lot of these post-traumatic stress syndromes are made from drugs. Spiritual emergencies. Um, this is a condition that occurs when some patients receive a type of spiritual trauma. And this can be a problem as people try to push open their spiritual awareness and try to unfold naturally. So, people that are maybe using drugs for spiritual awareness, or maybe doing something to help them with a personal transformation, maybe they have a reaction, and they're losing connection with their bodies. Common symptoms include feelings of oneness with the universe, vision, images of distant times and places, sensation of vibrant currents of energy, spasms, trembling, visions of demigods, deities, demons, insanity, fear of death. So it's kind of like a break uh, with reality. Participants can include anything from powerful losses, diseases, accident, extreme physical exertion, childbirth. Sometimes the personality is unable to assimilate the inflow of light and energy, overwhelming in suddenness and intensity. Um, the sudden influx of energy may express itself in uncontrolled unbalance and disordered behavior, shouting, crying, singing, outbursts of various kinds. Often, some become so engrossed in what they're going on inwardly they cannot perform well in daily tasks. So this can be diagnosed as a schizophrenic or having a psychotic break or a nervous breakdown. So remember, this is kind of like a post-traumatic stress syndrome, um, where they have a break with reality from their body. So many remedies are useful for this condition, and most of the remedies here are drug-like remedies because spiritual emergence or moving to a higher level of consciousness, either through meditation, drugs, or some type of technique, your body may not be ready for it, and it is kind of like a drug like state. Anhelonium contains the alkaloid mescaline, and it's merging one's surroundings, no boundaries, fear of losing one's existence, which is more than the fear of death. So it's the fear of losing one's existence, tremendous blankness of void and emptiness, no, feeling that they have no root, no identity, ego is separate and totally mortal. So anhelonium is the remedy for that. Cannabis, cover up for a feeling of inadequacy in facing threats, dangers, and risks to the outside world. Colors become brighter, sounds sweeter, distances are exaggerated, life becomes extremely peaceful and beautiful. Um, Behind the fantasy lies fear. The outside world is too harsh. The inside bores him. The outside terrifies him. Therefore, does the cannabis inside the house for stimulation. So, this is another remedy. And a lot of times you can go into these states by being exposed to drugs or doing some of these drugs. You'll get locked into this state, this spiritual emergence state, which can be related to the post-traumatic stress syndrome. Hydrogenum, uh, and this is particularly useful in helping people who have had near-death experiences, separated from the world, that everything is strange and real. This conflict between higher consciousness and worldly existence, space thought, feelings, silliness, laughing over serious matters, problems concentrating, and difficulty with space and time. So, this spiritual emergence related to near death experiences, these are three remedies: the anhelonium, cannabis indicus, and hydrogenum, which are very useful remedies for bringing the person back into their body, bringing them back to earth. Okay, that's all I have. So I hope that some of you might have some questions now. I'd like to spend the rest of the time kind of answering questions that you might have, not only with this lesson, but also with lesson 1 and 2. I've recorded this, so I'll be sending you a link for the recording. I've had some difficulty loading these long recordings, but I have talked to technical support, so hopefully the ones that you might want to listen to in the past that haven't been uploaded properly, let me know, and I'll try to upload these, but hopefully these two will be uploaded without any problem. So, any questions? Okay, I'll be sending you 2 more cases to work on, and I did get some nice feedback um, from some of you. Does anybody have any success in treating colds or flus? Have anybody attempted treating any colds or flus over the past month since our last cold and flu class? Anybody want to share? Um, I guess Veronica. Veronica, are you there? No, I think Veronica had to leave early. But Veronica sent me a really nice report in treating Marek's disease in chickens. And it was a young rooster that was 20 weeks old, unable to stand or sit up, head drawn tightly to his chest, lying on his side, feet curled under, feet twitching, comb back, unable to eat or drink. And for 2 weeks, he was fed with an eyedropper. Veronica thought he was dying, and she gave him arsenicum album. And after 30 minutes, he was on his back, his head drawn tightly to his chest, legs in the air, twitching, feet curled. And then I don't have all the notes here. And then it was given belladonna because of the nervous symptoms. And after giving the belladonna, the symptoms were aggravated for a day and then slowly went away. The next day, he was up and eating and drinking on his own. And he did well. And then later on, he was given calcarea carbonica, and he has been fine ever since. He eats and drinks on his own. His feathers are beautifully colored. So this example of homeopathy can work very well in animals. There's a lot of homeopathic vets out there. Sue made a comment that she treated her grandson with one of the remedies for a cold, and it really worked. Would you mind, Sue? I don't know if you're there. Would you mind sharing with the class? Would you mind sharing with the class what happened? Hello, Sue. I don't know. Yeah, can you?
Hi.
Yeah, would you mind sharing with the class your experience?
Well, I used it a while ago, so can you hear me
Yeah, I hear you fine. You're coming
talking?
through.
Okay. I believe it was about a month ago, but I believe it was the Hepar sulfurous. Does that
Hep,
make sense?
yeah,
I want to make
Hepar.
sure I'm not.
Yeah, and do you remember the symptoms that?
Um, yes, he was real runny nose, real irritable, and it came on quickly. And let's see, it's been like a month ago, so I'm trying to remember exactly, but I didn't know how to dose him. I didn't know how to dose at all. So I didn't want to give him very much because he's just 18 months old. So I
Mm,
gave him 2 little pellets on my finger,
mm-hmm,
and of course he really liked it. So um, he seemed, I'm not kidding, like in an hour he seemed so much better. And then I didn't realize at that point I wasn't sure. It was before I did that second class, and I didn't know not to do it again, but I did. I did it like 3 hours or 4 hours later.
mm-hmm.
Before he went home, I gave him a couple more. And then my daughter said that he was fine. He just like never materialized to anything. So I thought that was pretty good.
Good. Yeah, but I like
Although,
to hear. I
I
like to
mean, I
hear.
wasn't sure, but
Yeah,
if I was giving him enough, but
yeah.
I
All it
found
takes.
out today that I did give him enough.
Yeah,
Pardon?
all it takes is just one pellet. You don't have to give that much. So, always just give the homeopathic remedy and wait and see if they're getting better and improving. Don't repeat. I don't think you're going to cause any harm repeating
Yeah.
in an acute case, but sometimes if you give it too much, you can actually cause a proving. But thanks for
Yeah.
that information. And
I did do something wrong though because I had too many in my hand and I put them back in the bottle. So does that mean my little jar of stuff isn't any good anymore?
no, it's still probably good, but I think if you repeatedly do that, you might, antidote or dilute the strength, the homeopathic remedy. So I don't think you have to worry about it. I don't think you have to worry about it.
Okay, thank you.
Okay. Thanks. Okay. Hey,
Thanks.
Todd, would you like
Mm-hmm.
to talk about? Todd, are you there? Would you mind talking about your daughter?
Yeah, she's in college, and a couple weeks before finals was starting to feel run down, and said, "Oh, feels like I've got cold and starting to feel a little achy coming on." And so kind of went through, and seemed like Rust Talk seemed to be the one that was the closest, although couldn't find a perfect match. And give it a try, and yeah, she just held on for a couple of days of just very mild symptoms, and then she was back to normal. So
Do you remember what was the main
able to
symptom?
head it off at the pass.
You remember what the main symptom was that why
Oh,
you
let's see.
chose?
Boy, I don't off the top of my head. I wrote it down. That's
Mhm.
in a different part of the house.
Yeah, what I'm hoping is that everyone in the
Trying to
class,
remember.
I'm hoping that everyone in the class, record. I want you to really try treating any acute problem or acute case. Try, and I want to hear about your success and your failures because maybe then the whole class can contribute. And I think that's the best way for all of us to really learn. We share the cases that worked and we share the cases that, just didn't do a darn thing. Um, so,
I think it might have been the tickling.
hmm the tickling.
Uh huh.
You mean the tickling
And
sense?
the throat.
Okay, the tickling in the
Or
throat. Okay. Yeah, sometimes when you get that peculiar symptom, that just is a no-brainer. Leads you right to the remedy. Leads you right to the remedy. But okay, good job. Anybody else? Anybody else? Okay, so we got the cold and flu symptoms coming up. It's the cold and flu season, so there'll be plenty of opportunity, and we have the holidays coming up, so there's going to be a lot of overindulgence, indigestion, gas, things like that. So review your notes from the colds and flus. Review your notes that we covered this section on abdominal colic, indigestion, things like that. So, and take your notes on your cases so you can share next time. So I don't have anything more. If there's no other questions, I want to wish everyone happy holidays, Merry Christmas, and a good New Year. I'll be sending you the PDF of lesson number 4, the outline of all the slides for lesson number 4. You also get a link for the video of this class. And thanks for participating, and everyone, good job on the quiz. And everybody did a good job on the homework assignment. And I'll be sending you 2 more cases. But I'll tell you what, I'm really tickled because I can see that this class is really, really progressing. In fact, in my mind, it's just amazing how much you know at this point in time compared to the first lesson. So, congratulations to all of you. And I'll look forward to the next class. So thanks, everyone. Take care.